American children do not benefit enough from the polio vaccination for it to be given without a lot of discussion. And if your doctor won't discuss vaccines with you, if your doctor doesn't respect your right to be informed about vaccines and all other aspects of your child's health care, get a new doctor.
A lot of people are asking how to find a good doctor. Any recommendations?
How to find a good doctor. Again, for me, one of the things that if a doctor is knowledgeable about breastfeeding, that doctor has taken time to evaluate the cornerstones of good health in your child. A doctor who's willing to sit and talk with you, who gives you time, is a doctor with whom you may disagree, but at the very least he's showing some respect for your point of view and your right to have a point of view. If you go, I keep sending people to Dr. Sears' website. Go to my website too. But Dr. Sears' website has vaccine-friendly doctors. I hope he sends you back to my website. I have a DVD about vaccinations.
Go ahead and give him your site. Well, answer this question.
Answer this question. I'm a baby nurse and a parent coach and asked repeatedly for my opinion on vaccines. Can you give me an answer or a website? Thank you, Libby. Vaccinationsdvd.com. You can buy my DVD. It gives my moderate public approach to vaccinations, which is talk to your doctor, look hard at vaccines, consider which vaccines are relevant to your family. Again, I happen to believe that an individual child is safe with a vaccine schedule completely different than is recommended.
Okay, you want to wrap it up? Anything you want to add? Disclaimer?
A disclaimer. Is this where you say this advice is not meant to replace the advice of your doctor? Sure it is. Sure it is. I think that your doctor may not be as open about vaccinations as you want your doctor to be. My advice is to look at the schedule that's being offered to you and your child and to ask your doctor to tailor-make that schedule for your child and for your family and not to follow one-size-fits-all.
What age do you start?
I don't start vaccinating under 6 months of age. I prefer to wait till 12 months of age.
And which vaccines are absolutely necessary?
I don't believe that any vaccines are absolutely necessary. I think that the vaccine which has the best risk-benefit analysis is the DPT, diphtheria, whooping cough, and tetanus. Whooping cough is the diphtheria component just goes along for the ride. It appears to trigger a bigger immune response. The P is pertussis, which is whooping cough, which is a disease you can catch. We've had a good whooping cough year. I haven't seen any whooping cough for at least a year, maybe longer. But it's always out there, and it's a miserable disease. Very rarely fatal, very rarely does it put a child in the hospital, but it is a miserable 2 or 3 month cough. The T part of the DPT is tetanus, a disease which we see in America an average of, I believe about 35 cases of tetanus each year. The average age is about 60 years old. It is not a disease you can get easily. However, most parents worry about it. The reason that the DPT has the best risk-benefit analysis is that you actually can get whooping cough. Parents very much worry about tetanus, and that shot might be worth it to you. I'm very comfortable, though, not giving that vaccine or any others as long as the parents have thought about it and they're very well informed.
I think that'll do it.
And that'll do it. Thank you. Thank you.